Yeah, and also Elizabeth was one of the basically AIM co-founders and the first program director when we actually had significant funding to pay her for her amazing work. So it's sort of exciting that she's back with us. Okay, so I'm sure everybody is anxious, unsettled, or unsettled, and sort of, cautious about what's going on with the new variant. I want to, first of all, let me answer two questions that were asked by, I don't remember who asked the questions. So one question is, do we have a test specific to Omicron? No, we don't, and we're unlikely to have one, just like we don't have any test for any particular specific strains. Most of the tests do not test particular strain, they test the immune response to the strain, thus we really cannot have an isolated response to a particular strain, or at least for now, we don't have such tests. The second question was, oh my, I don't remember it. Okay, Janet, can you find a question while I'm
sure.
Giving my other spiel? So let me give a little bit of a, which I think is hopefully going to be anti-anxiety appeal to everybody, or at least that's the intent. And if I'm wrong, oh, be it. So here's what I think. I think this is a very good thing what's happening, because actually this is the virus that, for my read, appears to be exceedingly mild in terms of disease. There hasn't been a single case of the death. There hasn't been a single case so far of the severe lung disease or any organ failure, meaning everybody who contracted it, even people over 65, had recovered in less than a week, and they had only very mild symptoms. So it's a highly contagious virus with over 50 mutations, which is puzzling to virologists and sort of scary in overall picture, because you would think, well, how could this happen? The thing is, though, there's absolutely nothing new. We knew this would happen. We knew this pandemic is probably with us forever. We would not call it pandemic. We will just eventually call it, just like we're calling a flu season, we will be calling a coronavirus season, or whatever we want to call it. The good news, though, if this virus basically replaces the Delta and there's a zero mortality, and moreover, potentially the fact that it's so mild that it's not even clear what role vaccine is going to play in the future, we basically may be getting way closer to the management step, especially since we're probably getting closer to therapeutic steps of management. So the second question, now I remembered, Janet, it was about the Merck drug. So the Merck drug is actually just got FDA approved. It was just suggested by FDA panel to be approved. So it's an advisory panel. It was borderline suggested, so they come very close to not recommending it, because the actual final efficacy was very low. In the first arm of a study, the efficacy was somewhere closer to 50% or 40 some. Second, it was less than 20, and it was actually statistically borderline significant. So they sort of end up recommending, but saying, nah. And unfortunately, drug has tons of, well, not ton, but several very, very serious side effects. So they sort of came close to saying, nah. The Pfizer drug, on the other hand, is probably going to be more efficacious, but we don't have the final data. We don't have an FDA advisory wins on that just yet. So that's stay tuned. So neither drug will be available for months, because even after the advisory board, there is an actual FDA approval, which may take weeks to months. So the person who asked the question, how can we get this drug? No, you can't get this drug. You can't even get it now as a part of the trial, because the trials are over, and I'm not aware of any of them ongoing at the moment. So that's answer to the questions. In terms of the additional spiel, so just one more minute that I want to take. The reason I'm actually, about a year ago, when we had one of this conversation, I still remember, I don't know if anybody remembers this, maybe we can go back and track this in records. I literally said, look, we're going to have lots of different variants, they're going to keep popping up, and eventually this process is just going to become endemic. This is exactly what's happening. And we're not going to stop this. It's already here. It's already in California. And the data to be shown whether or not more frail, older population is going to be at the higher risk. I haven't seen such a data, but I have a feeling that's not going to happen. And the reason is when I looked at the data, who got sick in South Africa, there are a lot of people over 65. They're over 25%, and everybody recovered in a week or two. And the symptoms, this is really important. Nobody got short of breath. It appears that this particular variant does not target the lungs very strongly. So maybe it will mutate again, which is what the fear is. But again, there's a lot of maybes, and reacting to this the way that we're currently reacting out of fear is very bad news. We should really stop doing that because it's really not serving anybody. And another little moment of interesting change in, I don't know why, but Office of CMS, Medicare, Medicaid stopped today, just announced that they will not require licensing agencies in any states mandating vaccines for healthcare practitioners, which is a very strange reversal of prior thought process. Previously, they were saying we're going to mandate vaccines for everybody, and they just stopped doing that. So it's basically now back into the states to decide what they want to do, whether they want to mandate or not. With that, maybe, chat. Let's see, questions.
A lot of questions.
Yeah, so Janet, I answered that question, right? Yeah, so Elizabeth asking, is it safe to travel? Yeah, so here's my point. Nothing changed, nothing. Just what we talked 2 weeks ago, 3 weeks ago, 4 weeks ago, 5 weeks, same exact thing. Nothing changed. It's still safe to travel. You know, I'm not quite saying let's start having COVID parties and all get infected because it will boost our immunity, but it's actually not out of the crazy here. I'm not kidding. I've read several very senior virologist opinions saying that this may be one of those weird cases where if the disease is so mild, we shouldn't really be worried about being infected whatsoever. We don't know the data yet. We have to wait. We have to see where things are going to go. But the only thing I would recommend is this: no change in safety guidelines, masks, vaccinations. If you do for the booster, get your booster. The fact that now booster is recommended to everybody does not change anything. It does not change the science. The science didn't change in 1 week. It's political statements that now states recommending boosters for everybody. Yet people who have been vaccinated less than 6 months ago, and they're not high risk, they don't need boosters. People who are relatively healthy, young, and have been vaccinated more than 6 months ago, it's a little bit more of a gray area. If you want to get a shot, get a shot. I'm not, because I don't think there's enough evidence for that. So that's with that. But yeah, if you need to travel with, if you a little more cautious, travel with N95, you know, on a plane, put the mask, put the face shield on if you want. Otherwise, no change. Okay. Do we know yet how effective current vaccines? No, we don't. Unfortunately, we have to wait. I have not seen this data, but the suggestions that I'm reading, they're not data, they're opinions of experts, basically saying there's going to be some partial protection, but they just don't know to what degree that protection is going to be. It's also not clear as to how much that protection needs to be, because we don't really know what is the percent of people who are going to get really sick and for whom that protection will be essential. We just don't know any of that. Will a BMX kit pick up all the variants? I don't know the answer to that question. Hold that to next time until I research this. But I think the answer to this probably is yes. Okay. So no, it was mild in everybody, vaccine or no vaccine. So cases in patients who were not vaccinated in South Africa were just as mild as those who had vaccine. So that's really important point. Thank you.
Misha, do you want me to read the question and then you can answer it?
We could. That's
okay,
because
some of these are kind of sounding like non sequiturs.
Yeah, and it's not recording. If I don't read we don't read the question, we don't record this because chat doesn't go into record.
Yeah. Can you say something about what the CEO of Moderna said about the vaccine and Omicron?
Yeah, so the CEO of the Moderna basically said they are concerned that the Moderna will not be very effective against Omicron based on number of mutations in the site where that was used for development of the vaccine. So they are afraid of the escape of the immunity there. However, he also sort of hinted to the two things. He hinted there will be a partial efficacy, and he also hinted that they're also already working on modifying the vaccines. And not that I'm actually, I probably shouldn't say this, but I'll say it anyway. And I also know from some insider information that the same is happening at Pfizer. And so my expectations are that we will have modified vaccines very quickly, just like we would have them for every year for flu. Now, the question is, what is that time? Is that time going to be 2 months from now, 3 months, or 6 months? Because that is important, because if the virus is that contagious and in 2-4 weeks we're all going to start having cases, then it would probably be important to have the vaccines sooner. So,
And we have one more question. Can current mutations avoid T cell protection?
No, mutations have nothing to do with T cell protection, but T cells need to be triggered for them to be active. So if the immune system is not recognizing virus, in essence, there is no T cell protection. But once they kick in, I know it's a little not pleasant explanation or not desirable explanation, but that's how it works. You need to have a recognition first, and recognition occurs primarily by antibodies. If they're not there, the T response will occur after the body's initial response kind of not there. So they're going to be delayed response, and potentially, that's the whole point of vaccines, expedite the response, clear the virus very quickly, have no symptoms or very mild symptoms, and move forward. But no, T cell protection is always there. It has nothing to do with what the variant's doing. It's really more about, do we have protective antibodies to recognize virus ASAP? And will the antibodies be able to attach to see the virus?
Okay, and I think we'll wrap up the Q&A today. We had a couple of questions come in. If the folks who put those questions, Kathy and Benita, if you could email them to me, that would be great, and I'll send them to Dr. Kogan next week. So I'm gonna just type my email.
They're very good questions, by the way. So we'll definitely hold them to next week.
Yeah. Okay. So now, is there anything you want to say about Dr. Zarr, Misha?
Yeah. So yeah, welcome first of all. Quite psyched. We actually, Rob, you'd be very pleased. We actually had multiple times on this. It's weekly, so we have this weekly event. We had Sage, who's been our nature walking guide. I don't know if you know him. I think you do. And so it's just exciting that now you, who sort of started this whole thing now, I don't know, it's been probably close to 10 years, that, so it's great to have you. And I hope you share with us a little bit of that and whatever else you want to share with us.
Thank you so much. Yeah, I am glad to be back. And let me see if I can share my screen real quick and pop up just a few friendly slides here for us. I think I can get this onto, there we go. All right, I'm gonna minimize everybody. So I won't see you and I won't see your hands up and things like that. I don't know if you wanna do questions at the end, if that's okay with everybody.
Yeah, I think that's good. Mm-hmm.
Okay, awesome, all right. So yeah, it's been about 10 years. I am at the moment not practicing. I am in Ottawa, Ontario, Canada for the next 2 years. So working out those details as the months, the next few months to see whether I can practice up here or not. But I'm definitely continuing in my passion for the science of nature and health and how to really put that into practice. I put together a few slides to go through a little bit about what this really is again, and how nature and health are related, and maybe even how to incorporate some more outdoors into your own lives, and maybe hopefully your clinical routines as well. There we go. I won't go into too much of my background, but I will say that I grew up in Texas and California, Illinois, and Iran. And I did most of my training in Texas, and then left for Washington in 2001, and then left Washington in 2021. And that brings me to where I am today. I practiced for about 20 years at Unity Healthcare at a community health center, Upper Cardozo. Many of you probably are quite familiar with that, right across from the Target in Columbia Heights. And on the bottom right is the Capitol grounds. This is before the insurrection. So it was during the pandemic. I think I have a mask on in that picture, probably not necessary, but I did have one on. And this is in the Upper Senate grounds, which was really a place I would go to quite a bit for some quiet time. It's interesting that it's right across from the nation's capital, the center and the seat of government, but it was an amazingly quiet, peaceful, tranquil, meditative place that I would go to quite a bit. Really miss that. This is something that I don't have to talk about too much, but something that all of us who either practice or have been practicing for much of our adult life see every day, really, right? Some element of this, or some combination of this, and lots of comorbidity. I'd be remiss if I didn't point out that that healthcare professionals, people who are delivering some service in the healthcare sector, also suffer quite a bit. So I'd say we're probably in some ways more alike than we think we are, that many of us think we are. There's a lot of burnout in physicians. There's a lot of fatigue, chronic stress. There is what some call moral injury. There's unfortunately a lot of depression, and a bit more depression among physicians, especially female physicians in the general public. And it often leads to suicide, very sadly enough. So I have, and Misha probably has noticed this change in my focus a little bit over the last 10 years, where as I was focusing almost entirely on the patient, Unity Healthcare provides it's a healthcare, really, it's a safety net. And so I was very much focused on solely just the patients. But as the years have gone by, I've noticed a lot of problems, a lot of mental health issues, a lot of physical health issues, well-being issues among us. And so it's really kind of created an awareness in me. So I like to pass that along. Is there a preponderance of evidence that being in nature is good for us? I think that many of us would probably say that it should just be common sense. There's been several decades now of research. The research spans the spectrum from very small studies to some larger studies to systematic reviews, which include some meta-analyses. More of those are popping up. Correlational studies, cross-sectional studies. And my take on this is that we're gonna need more research. There's no doubt about that, especially clinical trials. But there's quite a bit of evidence, interesting evidence out there already, that spending time in a nature-rich setting is what I would call it. For many people improves their well-being. It decreases their stress. It helps with attention restoration. It helps with cognition. For many people who spend more time outside with others, there's a social element to it as well. So we see some improvements in the problems of social isolation. And then on the more physical side, numbers of different studies looking at all kinds of health indicators. I won't call them outcomes necessarily because there aren't that many controlled trials yet. But certainly, you know, probably you all are aware of the studies that started out in Japan with Shunrin-yoku and have now spread to Korea and parts of Europe, US, Canada, other spots around the world. So, but those studies initially looked at, you know, things like salivary, you know, cortisol, reductions in that. Some of the initial studies, I think it was Dr. Lay who did, you know, looked at blood pressure reduction, looked at, speaking of immunity, Misha, they actually looked at natural killer cells, you know, a documented rise in the activity and then a sustained rise up to about 28 days. So this is after like I think it was a 3-day, 2-night excursion into some of the forested areas in Japan. Which I'm happy to say I was able to visit in 2020 at the very beginning in January. So I actually went out on a nature guided walk by a Japanese forest and nature therapy guide for about 3 hours, and it was spectacular. So really amazing. You can kind of see firsthand what it's like. I won't go through the whole list, but there's a lot actually that I've seen in the literature, and there continues to be more. I'm right now in the middle of a controlled trial myself, and it's an NIH-funded study. Deb Cohen is the PI, I'm a co-PI and a site PI, and the clinical site for us is actually Unity. And we're in year 3 right now. Our intervention is, drum roll, nature prescriptions. So it's a pretty simple design. We've got a control intervention group, 6 to 16 years old. We're looking at our outcomes that we're measuring, accelerometry. We have a pretty extensive survey, asking all kinds of different questions that vary from you know, inactivity, screen time, stress. We've got a tool that we were going to use on an iPad face-to-face, but the pandemic sort of changed that. So we're asking a few more questions using a different survey tool that looking at memory and cognition. And then we're going to mine a bunch of data from the EMR. The participants will be enrolled for 2 years, 5 measurements, baseline 3, 6, 12, and 24 months. So it's a good period of time. And I'm happy to say we're using the platform I'm about to give you a peek into. Many of you already use it yourselves. So we're able to ask a couple of more questions, one about nature connectivity and one about mood after each prescription is filled. So 2 groups, intervention, control. Control gets care as usual, intervention gets care as usual, plus a nature prescription through our platform in as many visits as possible, recommended anywhere between every 1 and 3 months. So we've got kids who are enrolled. Eligibility criteria, besides age, the most common criterion is overweight/obesity. We've added a few other, obviously, but those are the main ones that we're seeing. And preliminary data, you know, we had a significant, you know, gap in accelerometry and some of the like questions that you would see to, you know, physical activity questions, self-reported questions on the surveys. It seems to be narrowing a bit, but it's still pretty early. So we'll see what this shows in the end, but we're pretty excited to be able to do this kind of research. So this is our mission statement. I thought I'd just kind of throw this out there. I just revised this. We're in the middle of doing a pretty major revamp of our website and platform to prescribe, and wanted to kind of throw it out there for you. This is really what we believe, that nature-rich areas should be accessible to all and incorporated into our daily lives. I don't usually read slides, but I'm going to read this one. Spending time in and around nature is the single most important first step to improving both human and planetary health, as it's called these days. PRA is committed to educating healthcare professionals and the public and to providing the tools to meet each individual's unique needs. So we started about 10 years ago, or I started about 10 years ago. We had something called DC ParkerX. It's now become ParkerX America, and I'm in the process of kind of transforming our name a bit to PRA rather than ParkerX America, mostly because, you know, I've found over the years that park is a term that can be limiting to many people. So I think nature is probably the better word to use, but people often still call them park prescriptions. But they're more, for me, they're still pretty synonymous with nature prescriptions. We created a platform back in 2017. We went really quite like a live launch in January of 19. It hasn't been that long since we've had a pretty revised platform, and we're about to go through another revision now. So 2022 will be yet sort of a new launch for us. We, as I mentioned in our mission statement, it's quite a bit about educating and training. Educating about the science and training how to put that science into a tool, a daily tool for your practice. And I mentioned, not just our work directly, improving that interface with the public. So it won't be just about healthcare professionals prescribing. It'll be about educating the public and really getting the public to educate us as to what else can be done for their hypertension and depression and anxiety and lots of their chronic issues. Mostly in the U.S., although I've got some prescribers signed up in other places around the world. I guess part of my travel in 2019 and 20, I was able to give a few talks around the world as well. And even prior to then, I had traveled to Mexico. So we've got a Spanish-speaking population that I've seen an interest in this as well. We have a little over 1,200 health professionals who've signed up. I think we're the largest, at least provider-based nature prescribing platform that I know of. There might be something out there I'm not familiar with, but as far as I know. Canada has a program, a platform and a program, and it's called PA capital R small X, and I know Melissa, who's the founder, and she said she has about 1,000 now, so they're doing really well in Canada. They only have 100,000 licensed physicians, and so they have 1,000 signed up, which is pretty impressive, 1 in 100. We're not quite there in the US, so the more the merrier. We've issued a lot of prescriptions, and many of them have been filled. So there's what we see on our end in terms of fill rate is an underestimate. We know that for sure because a lot of people will fill their prescriptions. A lot of health professionals will prescribe, but don't necessarily document it. So we'll be tightening that up in 2022. So a better look at what that looks like. What I've been doing for many years is sort of demystifying this nature script. So on the left is your standard medication prescription. On the right is your nature prescription. And there are really 4 components to it. There's a place, there's an activity, there's a frequency, and there's a duration. And as long as you get those 4 components into it, I would say that in my book, that would be a nature prescription. It's important to document, what you do, because if you don't document it, then you won't have that there to refer back to. So that's very important. We made that really easy to do. Our platform is not found inside of EHRs. It can be linked to EHRs. So all of the work gets done in our platform in terms of creating the prescription, in terms of creating the reminders, in terms of following all of your work, your previous prescriptions, and how they've been filled, etc. But that very last step is to copy and paste that into your EHR. We have a lot of functionality in our platform, which is going to be much easier to use, in my opinion, in about a month. I think it's pretty darn easy right now, but there was some cleaning up that had to be done. And so that's what we're doing now. It's important to identify a place. That place was a park, right, in the past. And a park finder was a really big part of the prescription process. That's kind of how I started doing this 10 years ago. And we're de-emphasizing that now. It's not about the park. It's about the patient. It's about that conversation between the patient and the healthcare professional. It's about asking the right questions, honestly, and asking the right questions in an efficient manner gets you to where you need to be when you're dealing with time as a bully. You know, what is our job as a healthcare professional, really? So it's not just to find, you know, an agreement with your client, you know, where that place is going to be. It's not just finding, you know, what activity they're willing or interested in doing outside, or more of it outside, or with whom outside, on what days, what afternoons, what mornings. It's not just about figuring out, you know, how many days a week and for how long they can commit to be in that activity outside. It's also about being a, you know, in my case, a doctor, you know, in your case, whatever your specialty is, and using your clinical judgment to either amplify or sometimes to take it down a notch. You know, if patients are too ambitious, you may need to take it down a notch just so that the goals are more realistic and can be met. Every script is unique. Every conversation is different. This is not about, this I think should resonate well with the center. There are no two prescriptions that are entirely alike. This is not Kaiser. We do not tell every single patient to walk 20 minutes a day. It's, you know, walking doesn't work for everybody. So it's really about the uniqueness of every prescription and the uniqueness of every encounter. So same patient, same healthcare provider, or same healthcare professional, unique prescription every time. Every time they come in, every time you talk to them, every time you do a telemed, there can be a new, and should be, in my opinion, a new conversation about this and a new prescription generated. Nudges, it's our job, right? Our job is to kind of nudge people along, to be that cheerleader, to use our wonderful social skills to do that motivational interviewing and move people along in the right direction. Safety, comfort, right? This is not about pain. One thing that I'm sure Sage talked to you about was POP, you know, pleasures of presence, right? So it should be pleasurable. That's not to say that a little bit of risk is bad. Anybody who's read Biophilia, you know, has a glimpse into the curiosity we have with danger, right? It's built into us. It's innate, right? So we are kind of interested in snakes, but we're also scared of them at the same time. It's good to walk in winter, but you can slip on the ice and break your ankle. So there's always a little bit of this, you know, back and forth and balance you have to find. Let's see if I can move forward a little bit here. Here are some examples of prescriptions that I've done myself personally to give you an idea. Every one of them has a place, every one has an activity, a frequency, and a duration. It can vary in age from just a few days old to sky's the limit. I'm a pediatrician, so I see up to the early 20s, but there's really no limit in this. And the benefits, as you can imagine, are enormous, right? So even a few days old baby, the mother and the baby need to have some natural light, some fresh air, and there's advantages really for everyone involved. You know, I don't want to take up too much longer. I'm guessing there might be some questions. I think I was asked to carve out about 15 or 20 minutes. So I think I'm about there now, and I'm just going to stop my share so I can see you all again.
So do we have any questions, folks? You can unmute yourself if you have a question.
What's your favorite park where you are now? Where do you go now that you're out of DC?
You know, I get asked that a lot. You know, where's my, you know, where is the founder of PRA's favorite place? You know, my response to that is that, you know, more than anything, it's whatever is closest to me. You know, it could be this plant right now. I'm a big believer in taking advantage of what you have access to. I spent 20 years, you know, working with low income population with few resources. So it's.
Hello? Okay. I wonder what happened. Technical difficulties.
I know that my favorite park, I live really close to Meridian Hill, or also called Malcolm X Park here in Washington, D.C. And I think it's one reason is because there's so many benches and also levels. And in the summertime, there's water, and there's always some pickup soccer game. So it's not only being around the greenery in an urban environment, but also the community of what's going on that brings me. And also developed a love for Calorama Park recently, and their several different age grouped playgrounds. So that's become very appealing. But for me, it's so much, yes, and great drumming and music. That's right, Alyssa. They're every Sunday at 4 p.m. till whenever the evening ends. So I guess this time of year is less relevant, but there's a drum circle, and it's spontaneous, and it's been going on for
Decades.
decades and decades. And in the summer, there's dancing, and it is the people in the community where it doesn't matter if you are where you're coming from in the neighborhood. We're all together and picking up each other's kids, like whose parent is it, and like being in that space. It's so funny because the next morning it's the same people who aren't making eye contact on the bus, normal times, but in that moment, there's something to be said. So I find it to be really enlivening to be not only in nature, but all nature in community. And I do look forward to when the fountain and the bottom half of the park are complete. So there are certainly other wonderful options here in Washington, D.C., and I'm excited to learn what the options are in your communities. Is there anyone else who wants to offer a place of destination?
So I have attended on a regular basis since 1979, what I call the Church of the Closed Off Park, which is in Rock Creek Park. They used to close off several sections on weekends, and since the pandemic, they've closed them off permanently. It's toward the north. You can get there on the metro by getting off at Van Ness and walking down Tilden, and that's kind of the start of the lowest, the most southernmost section, which is about 1.5 miles long. And you can walk, bike, roll around on the street, and no cars will come through.
So Elizabeth,
Yes,
it's that time.
Wonderful. Well, first, thank you so much to Janet and Dr. Kogan, Dr. Zarr, and for all of you for welcoming me back. It's been delightful. It's been so wonderful to not only see this continuing, but also now joining in, seeing so many familiar faces and names, my mother included. So I'd like to say hello to Kathy. And I really like the transition of what Dr. Zarr was sharing. And I've been kind of reading, and I think Frederick Law Olmsted Jr. was the one who actually designed the area outside the Capitol. And I think he'd be thrilled to hear that there's silence and tranquility amidst the lawmaking and rancor that happens there. So I try to take that, perhaps a message to heart. So what I wanted to offer today, since you all are so pro now at doing the mindfulness work, I wanted to provide you with a prompt. And if you have a moment to either grab a pen and paper, or you might hold it in your mind, I wanted to offer a prompt that you could then, write some thoughts down and sit with, or just be with in the moment. So, and this is from Rabbi Danya Rutenberg. And so I found, this is a friend, I saw this in her apartment yesterday, and it inspired me to provide this for you today. So deep breath. What would it look like if you treated yourself as precious, worthy of gentleness, attention, and care? What would it look like if it turns out you're fiercer, stronger, braver than you ever imagined? What if it's both? I'm going to read it one more time, and then I'm going to set a timer, and we can all come back after about 10 minutes of breath and reflection that you all know how to do. What would it look like if you treated yourself as precious, worthy of gentleness, attention, and care? What would it look like if it turns out you're fiercer, stronger, braver than you ever imagined? What if it's both? And for the next 10 minutes, I invite you to sit with me and each other in this space, in this moment. You don't have to be still and shrug your shoulders. Let's see if we all can just take a moment to look inward together. I hope you'll join me. Stretch. Be gentle. You're doing great. No one texting you right now who is worth your attention. Your attention is yours. It is so difficult to pause. Wow. I don't know if anyone else having difficulty pausing. I was prepared for this and I'm having difficulty pausing. Thank you for joining me.
I don't know if we want to stop. Does anybody have any questions for Elizabeth?
If I may, Janet, if I could read something faster.
Oh, yes, please do.
And first I want to say that Irene, I know someone I know a small child who was a redwood tree for Halloween. So you're in good company. We're riddled with pointless talk, insane quantities of words and images. Stupidity is never blind or mute. So it's not a problem of getting people to express themselves, but providing little gaps of solitude and silence in which they might eventually find something to say. Repressive forces don't stop people expressing themselves, but rather force them to express themselves. What a relief to have nothing to say. The right to say nothing. It's only then is there a chance of framing the rare and ever rarer thing that might be worth saying.